With the demand for affordable health care rising statewide, health officials are cautioning funding for free and charitable clinics is now decreasing.
Yeah, many of these clinics provide services at low to no cost to people who can't afford it or don't have health insurance. WLWT News 5's Lindsay Stone visited a local clinic overwhelmed with patient requests and struggling to stay afloat.
Hi, sir. How are you?
St. Vincent de Paul Charitable Pharmacy is really a last resort safety net for people who can't afford their medications. Whether they're uninsured, underinsured.
Charitable pharmacies provide community members with medications for free. The need here at St. Vincent de Paul Charitable Pharmacy is continuing to grow.
Over 1,000 neighbors in need come in every month to get their medications for free. So we're able to dispense millions of dollars in prescription medications, saving the lives of many with diabetes, with asthma, COPD, with heart disease, just by making sure they have access to medications every day.
Pharmacies like these are funded by both state and federal dollars. But Ohio's free healthcare clinics are facing funding challenges.
We've experienced some cuts in federal funding that have impacted our insurance navigation program. That's one that we've already seen a cut that will change the way we operate as we then engage our community in other ways about how do they find paths out of our program.
Dr. Rusty Currington, vice president of the pharmacy, says other cuts may be coming.
We saw a 90% reduction in funding to insurance navigation services. And so a lot of changes within there as we now see that those changes impacting us right here in the grassroots. We're making plans to adapt about how can we serve our patients in the same way and even a better way.
St. Vincent de Paul serves over 1,000 patients each month. They had a record-setting month in May, filling nearly 9,000 prescriptions, totaling $1.5 million in free medications for patients. And while the future is uncertain, Currington focusing on one thing.
We want to keep our doors open. We want to make sure that we're able to say yes to the next person in line.
Every dollar that's donated to St. Vincent de Paul is leveraged to about $11.50 worth of medication. So every dollar really does make a difference. If you'd like to learn more about how to donate or to also donate your prescription medication, go to our website, WLWT.com. Lindsay Stone, WLWT News 5.